Okay, looks like we've got a pretty good group here with us now, so we can go ahead and get started. And if anybody else joins in, we welcome that. So welcome back, everybody, to Worcester Safety Council. We have Kelly Ott with us to do her BWC update, and then Erica Springer, the Executive Director with the Wayne County Regional Training Facility, is going to speak with us today. So I will turn it over to Kelly for our BWC update. There we go.
Thank you. Well, welcome everybody. I'm really glad everybody's participating. I just want to remind you again, we offer safety ergonomics, industrial hygiene consultations virtually, and we now are pretty open to on-site visits as approved. I'm Kelly Ott. There's my email if you're interested. kellyo.1@bwcstate.oh.us. And if you are interested in having us come out and take a look and give you some advice for improving safety, if you have industrial hygiene needs, we do offer those services, and we're doing a lot more on-site visits. Okay, next slide. This is a rather busy slide, but I want to make you aware that we have both virtual training and webinars. I think a really important one up at the top tomorrow, January 27th, from 9:30 until 1, there's a half-day workshop on OSHA record keeping. So I want to remind everybody, February 1, you need to have your OSHA logs posted until April 30th. And if you need help with that, tomorrow is virtual training for half a day. If you have questions or you want to kind of just take a look, are you making sure you've got everything recorded properly? That's a real good opportunity for, and again, you can ask questions, make sure you've got those logs appropriately done. We've got some webinars coming up again, and also training, lockout, tagout, job safety analysis. Again, on February 17th, hopefully you already had your log up. If there's any pitfalls or what you have to look for the following year for OSHA record keeping, there's again another webinar on that. To find out, you know, if when I'm done, you're like, what training was available, you can go to, again, our website, info.bwc.ohio.gov. If you click on events in the top, this whole list will come up for you. Okay, next slide. So webinars, I kind of pulled that out from the list. 7 habits of highly effective safety teams. It's that, you know, it's been really tough lately. So maybe if you want some tips from 11 to 12, it's a good time, kind of like a lunch and learn. How do you want your safety team to do like a watch or maybe learn some different habits? This is a little webinar for you. And then risk and safety of contractors is a little bit later on the same day. That OSHA record keeping, and then safe patient handling. For those of you who are maybe in the healthcare industry. So and if you missed something, you can always go to our BWC Learning Center. You type in www.bwclearningcenter.com, log in, and you can search the catalog and you can find those webinars if you missed them the first time through. Next slide. Micro training, we did just add, just to let you know, one on winter safety. So if you need a reminder, this is a really tough time of year, especially with slip, trips, and falls. I'm going to cover that a little bit. We did put together a micro training video on that. And next slide. To find that, you'll go to our website, www.bwc.ohio.gov. I usually use the search bar, type in training, and there's that micro training safety series. These are real short snippets that we put together if you want to send your employees reminders, trying to keep them safe, trying to keep them off that OSHA log. Okay, next slide. Safety Congress. We're going to be virtual again this year for 2022. I was discussing 23. We're really hoping to be a hybrid, both virtual and on site. But for this year, March 9th and 10th, for those of you who have been to our Congress, it will be virtual. You can go ahead and register. healthsafetycongress.com. And next slide. March 9th through 10th. We're going to have educational. You can get continuing education credits if you have certifications. There'll be an online expo, downloadable resources, and a scavenger hunt. And next slide, this is what it's going to look like. We're trying to make it as close to maybe reality, where there'll be a marketplace. So if you're looking for what's the latest fall protection, what's the latest gloves, what's the latest respiratory protection, that will be available in some of these marketplaces. There's education, the scavenger hunt. So we're trying to make this kind of similar to when you would come down to Columbus and you would actually see these different walkthroughs, but it'll be online. Next slide, please. Okay, slip, trips, and falls. And I'm seeing, we get claims, and this is really tough time of year. It's very cold. Really encourage your workers. Especially in the morning or leaving at the end of the day, it gets icy. Please have a plan in place to try and keep your parking lots, your sidewalks, your doorway entrances as free as you can of ice and snow accumulation. I know it's tough, but encourage your people to walk like a penguin because when we walk like a penguin, it actually keeps your center of gravity better and tries to keep you from falling. So really be careful when you get out those doors. Try not to carry a lot in your arms, and really, again, duck or penguin, keep your feet out so that you're more balanced. Next slide. And again, keep in mind any workers who are outside are in really this cold environment. It was 10 degrees this morning. Make sure they're dressed properly. These are signs of hypothermia. If they're shivering, if they have slurred speech and get drowsy, frostbite, look for redness, and heating at home. If you, again, or even in the office, I was like the office Grinch because you cannot have a space heater plugged into a power strip. It can catch the power strip on fire. So I was always very popular when I walked through and pulled out everybody's power heat, the little heaters out of the power strips. So in office cubicles or at home, they have to go plug directly into the wall. And that's why when you see fires, this can be very dangerous. It can overheat those cords. So make sure any space heaters are plugged directly into a wall outlet. And I guess here they tell you not to heat with your stove. I don't know if anybody's trying that, so please don't do that as well. And next slide. And again, you have a right to a safe workplace. If you have questions, as I said, we do consulting. And watch out, there's a lot of turnover, new temporary younger workers. So make sure that you're kind of watching out for them. And that's pretty much it. All right. Thank you from VWC.
Okay. With that, we'll turn it over to Erica.
Thank you. Let me get this going. So I just want to thank everybody for asking me to speak with you guys today. As Michelle said, my name is Erica. I am the director of the Wayne County Regional Training Facility. Today, I'm going to speak with you about ways you can prepare your staff, your family, your friends, community for a medical emergency, and how you can help us whenever it occurs. So some of the objectives today are going to be the importance of stroke recognition, importance of first aid and chest pain treatment, importance of early CPR and defibrillation, and that ways you can improve outcomes by assisting the first responders with some vital information. So I want to start off by telling you a little bit about ourselves, myself and the facility. Our facility started as a dream of some local fire chiefs. They were trying to find a way to have training closer to home. So in 1990, they were able to acquire 60 acres in Apple Creek from the state of Ohio for $1. Part of our property used to be part of the Apple Creek Developmental Center. Since then, we've grown into one of the best training facilities in the state. There are no other facilities with all the capabilities that we have in one location. We are a little different than other facilities in that we are not backed by a college or a trade school. We are a private organization, so we are a 501c3. We're nonprofit. So we do not qualify for any state or federal grants. Everything that we do is funded through our rental fees, our tuition, donations, volunteers, and through wonderful partnerships that we have developed. We are towards the end of our chief capital campaign that's involved several projects, including the building of a new burn building that we opened in 2018, the Roger N. and Betty Lou Geiser Education Center that we opened in 2021, and then the Seaman Corporation Water Rescue Training Site. And the end of our project here is going to be our future EVOC driving course. So all of our students have to take emergency vehicle operations. So we're working our way to get this driving course so we can hold everything right here on our campus. So I said, I'm the executive director. I actually started with the training facility in 2015 as the hospitality supervisor. In January of 2020, I became the EMS program director. As you know, that was right before COVID hit and changed every part of our lives. So we had a lot of policies and practices that we had to change down here and to meet and keep everybody safe. So we actually, our EMS program shut down for 1 week. Our instructors worked very hard to figure out a way that we could continue lecture, flipped everything to Zoom, and we only missed 1 week. Our fire programs were a little bit further, so they were not able to front load all their lectures, so they actually had to extend their class for a month. But we were the first training facility in the state to get back to classes as quickly as we possibly could. I am blessed to oversee 57 staff members and instructors, and I frequently will tell people our instructors and staff members have the largest hearts, and they are the most dedicated you will ever find. Our instructors take great pride in our facility and our students. We get just as excited to see our students be successful as what they are, sometimes a little more so. Our instructors have a combination of 1,409 years of firefighting experience and 1,393 years of EMS experience. And our experience comes from different areas. So we have instructors that are from full-time departments and volunteer departments. And we have instructors from multiple counties. So we have instructors from Ashland, Franklin, Holmes, Licking, Medina, Muskingum, Portage, Stark, Summit, Tuscarawas, and Wayne County. So it is a large selection of instructors that we have. We provide public safety training to nearly 50 counties in the state of Ohio, and training to 20 different states have been represented at a time. We provide fire and EMS training. And we just recently opened a Grindon prop. So we're going to be able to offer training in entrapment and things like that for first responders and industries. Our facility is also used for rental. So we have SWAT teams that come in and use our facility. We have cadaver dogs that come in, search and rescue canines. We've had the FBI down here using our facility. Fire departments can rent any of our props to train on, and then we have fire brigades for industries that come in and different industries that either rent our auditorium or rent different portions of our property. We do have several wonderful partnerships with companies from all over Ohio. And in Wayne County, we are very blessed to have a lot of fire companies and EMS located not only in Wayne County, but in the close vicinity and surrounding counties. In 2021, we had a very busy year. We had a total of 6,364 instructional hours. So that is about an average of 17 hours a day. We had an instructor working with some type of group or students doing some type of education. We were part of the farm tour in 2021. So we had 5,162 guests or students on our grounds. Our mission in all of this is to provide practice, education, and guidance to firefighters and EMT in Wayne and surrounding counties. We want to train them the best that we possibly can so they're ready for any situation and hope that they never need it. Tell you a little bit about myself. My full-time job, I am a full-time charge nurse in an emergency department. And there's no staff members here at the training facility that are full-time. We all do this as a kind of a side gig, as an extra job for all of us, just because we love what we do. I've been an EMT for 25 years and an EMS CE instructor. I am a board certified ER nurse, and I have additional training in trauma care, pediatric care, advanced cardiac life support, basic life support, pediatric advanced life support, advanced stroke care, and emergency services. I am local. I am a graduate of Northwestern High School. I've lived in Wayne County my entire life. I have a master's of science in nursing, leadership, and management. Like I said, I've got 25 years of experience in emergency medicine. So just kind of start our goals here. Stroke recognition, every year, 795,000 people in the United States have a stroke. 130 people die each year from a stroke or complications from a stroke. You're going to hear me say frequently, time is brain or time is muscle. So 1.9 million brain cells die every minute that a stroke is left untreated. And there are a few different kinds of strokes. So a ischemic stroke is a stroke that occurs when a vessel that is supplying blood to the brain becomes obstructed. A hemorrhagic stroke occurs when a weakened blood vessel actually ruptures and is bleeding into the surrounding brain tissue. You may hear someone say that they've had a TIA or a mini stroke. And what that is, it actually is kind of a warning stroke. This occurs when a blood clot blocks an artery for a short period of time. So the symptoms will resolve quickly and there's no permanent damage to the brain from it. But this is a warning that a larger stroke, a more permanent stroke, is in the future and need to have some different changes to lifestyle or medications to prevent it from actually becoming a full-blown stroke in the future. Early recognition is very important, and that's why we're trying to educate as many people as we possibly can in the community on the signs and symptoms of a stroke that may help save someone's life or decrease debility if they should have one. Another thing you're going to hear me say frequently is the importance of calling 911. We will frequently hear someone say that they could get the person to the hospital faster than EMS could get them there, which you may be able to get them there faster than EMS could get your house and get them. But EMS can start treatments immediately. They can recognize the signs and symptoms. They can contact the ER and say, hey, we're bringing in a stroke alert. Give us the symptoms, and then we can prepare as ER staff to get that patient to the hospital. Once they get there, we're going to do a lot of things very quickly. So we get them down to the CT scanner to determine what kind of stroke are they having. Get IVs started and blood drawn if EMS have not done that already for us. And they're going to see the ER physician and possibly a neurologist at the time that you come to the ER. And the neurologist may see you as a telemedicine visit. So we're going to notice a couple acronyms as we go through this today. But one of the first acronyms is Be Fast. So B is for balance. You may notice someone having a loss of balance or kind of an unsteady gait and some dizziness, kind of have that drunk stagger walk going on with them. Their eyes, they may complain of having blurred vision or double vision. They may only have loss of vision in one eye, or it could be both eyes or just a portion of one eye. They may notice a facial droop. You ask them to smile really big and you can only see a portion of their teeth. They may have weakness in their arm or leg. Normally that is on one side of the body. And their speech, they may have some issues with some slurred speech, inability to speak, or confusion. So whenever they have inability to speak, they may have they know what they want to say to you, but they can't get those words out. And that is very frustrating for the patient. And they may become very upset and agitated because they know what they want to tell you, but they can't say it. You could show them a pen and they know what that object is, but they can't physically tell you what that object is. And then again, time. call 911. Please don't drive yourself to the hospital. You know, call 911 or have someone else drive you. And I apologize, there are corny little videos in here, but they make it easy to put everything together and learn from it.
Honey, what can I get you?
Hi, I'd like cheeseburger with a side of French fries and a slice of pie.
Hey man, is your face drooping out of place? Hey man, the letter F stands for face. I said, hey man, no excuse, help yourself. Just go to the ER very fast.
Young man, are you listening to me? You must know A stands for arm is my plea. I say, young man, arm weakness is a bad sign, but you got to know this one thing. You really need to act F-A-S-T. You really need to act F-A-S-T. 911 is a number that you should employ. Minutes lost, the brain self-destroyed. You need to act F-A-S-T. You really need to act F-A-S-T. You should get yourself seen. A stroke could be the deal. If any signs of what you feel.
Hey man, if your words come out slurred, BS means that your speech is in trouble. The ER is where I'm sure you will find what you need if you get there in time.
The word time, that's the meaning of T. Act swift, man. When you can't walk the street, there's an ER. Go there, F-A-S-T. They can get you back on your feet. You really need to act F-A-S-T. You really need to act F-A-S-T. 911 is the number you should employ. Minutes lost, our brain cells destroyed. You need to act F-A-S-T. You really need to act F-A-S-T. Old man, young man, there's no need to feel down. Old man, young man, if a stroke has been found. F-A-S-T. You really need to act F-A-S-T. 911 is the number that you should employ.
All right. Okay, so like I said, it kind of corny videos there, but it really does make sense when you can put things together. So early recognition, there's a reason why if you come to the ER for something like this, EMS and the ER staff, we're going to be a little persistent because there's some very important information and timeframes that we need to know. So if the symptoms are found early enough, the person may be a candidate to receive a medication called TPA. And what TPA is, it's a medication that needs to be given within 3 to 4.5 hours of symptom onset. This medication can only be given to an ischemic stroke. This is a clot-busting medication. It cannot be given for hemorrhagic strokes because that is bleeding, and this is a kind of a blood thinner medication. So when you get to the ER or EMS get there, we're going to work very hard to determine when these symptoms started. So we're going to keep asking, when was last known well? And what we're asking for is, when is the last time that this person was completely normal for them? No symptoms, acting like they normally would. And then we want to know, when did the symptoms get discovered? Did you actually witness the symptoms starting? The reason this is important, so we know if we're in that 3 to 4.5 hour window that we can give this medication. So if someone was last known well when they went to bed last night, so they were completely normal for them when they went to bed at 9 o'clock last night, and then when they woke up at 6 o'clock this morning, they noticed that their right arm wasn't quite working the way they should. So their last known well would be when they went to bed. So we would be out of that window, but it's still important to treat the stroke as an emergency. So we would still call a stroke alert and things like that and move quickly. It's just that we would not be able to give that TPA. Another story here about the importance of TPA.
I was in the kitchen. I came upstairs. I felt warm. I called my son for some cold water. My arm started feeling funny. It felt like there was something tied around it or a rubber band or something. I don't know. My speech was messed up. Go get Dorian. Go get, because I'm still hearing myself. I'm like, something's not right. Dorian came in and said, oh no, Mom, you're having a stroke. You have to go to the hospital.
Althea came to the hospital in time, and she was having a relatively large size stroke. If the large blood vessel remained blocked, the stroke could have progressed to her having loss of language as well as permanent weakness on the right side of her body.
They kept saying, you know, luckily you got here when you did because they was able to give me the clot buster.
With the TPA, the clot busting medication, the medication did its job to open the blood vessel, remove the blood clot, so that the blood flow could be restored to that area that was already receiving some damage. You can see here that that's the area of damage. And Althea would have been at risk to have a stroke this big if not for the medication that she received that minimized the size of the stroke.
They was looking at me and I was talking and talking. Next thing I went for a little, and I was like, oh wow. I just started talking regular. It was like amazing.
So many people say it's like a traffic jam. You know, you have a blood vessel that's blocked with a traffic jam. This TPA just creates a lane so that blood can pass through again. She's had a good clinical result, and why we're really wanting to make sure we reduce her risk for future stroke. So once Althea made it through the emergency department, she came up to the stroke unit, which is a place where patients come to have very close monitoring with nursing and neurology, where she could really start the diagnostic testing of why the stroke happened to her on this particular day.
I could feel like the pressure.
It's really critical in those first hours and days that we get patients on the right medications to prevent further strokes from happening, recurrent strokes. So she underwent a series of expedited tests when she was on our floor.
Push up. Excellent.
The second branch of what we work on immediately upon arrival is getting recovery from the symptoms of stroke so that people can return to their productive lives.
I'm so glad I made it here to get the clot buster because I wouldn't be where I am right now. I wouldn't be talking like this. I wouldn't be walking. I can go to the bathroom by myself. I can take a shower by myself. I don't need help. I don't have to worry about standing up and falling over and stuff like that.
Seeing a patient who goes from having severe weakness on one side of their body and having devastating symptoms where they can't function for themselves, to being essentially independent again, like Althea was, walking and talking just fine. It's a really rewarding career, and researchers here are really figuring out how to tackle at the highest level the motor recovery after stroke. We're using innovative video games to help people to engage in their therapies. We're looking at different ways that we can help the brain recircuit itself to move around the disabilities that people have. And we're trying to find new drugs and new therapies that can extend the window of who is eligible for stroke treatments. And I think taking this comprehensive approach to research here at Johns Hopkins will really benefit future stroke patients tremendously.
Okay.
I was lucky.
And when the patient there said that she noticed a difference immediately, there have been patients that we can notice an improvement of their symptoms within minutes of the medication being given. So it is very important to notice these symptoms and get treatment started as soon as possible. So the next objective here was importance of first aid and signs of a heart attack. You may have a person tell you that they're having some discomfort in their chest. It's hard to say that they're having chest pain because not everybody describes it as a pain. If you ask someone if they're having chest pain, they may say no. So we learn very quickly, are you having pressure? Are you having a heaviness in your chest? Are you having discomfort in your left arm, both your arms? They may complain of discomfort in their upper back. Chest pain that goes straight through their chest into their back. It goes into their neck, their jaw, their upper stomach. They may complain of feeling short of breath, having cold sweats or being very sweaty, nauseated or vomiting, or having some lightheadedness. And like strokes, heart attacks are very time sensitive. It's important for us to get them in to get that vessel opened up so we can return blood flow to the heart tissue. So if they get to the emergency room or call 911, again, I want to encourage people to call 911. Several things are going to happen very quickly once you get there. We're going to get IV started and draw some blood, get you hooked up to a cardiac monitor. So there is a type of heart attack that it's very important that we get you to the cath lab immediately. It's called, this heart attack's called, we call it a STEMI, but it's an ST elevation MI. And what that causes us to move a little bit faster. So as you're at home calling 911, as I'm encouraging you to do, if the EMS do an EKG and they see that it is reading as a STEMI, they'll transmit it to the ER. We'll have the ER physician look at it, hear what their symptoms are, and the ER physician will say, yes, this is actually a STEMI. We'll go ahead and call a STEMI alert in the ER. You're not even there yet. We know what's going on, and we're getting, if the cath lab is there, cath lab hears it go overhead also, and they're getting everything ready for you to come in there. If it is after hours and they're not there, while EMS is driving you to the hospital, our cath lab is on the way to the hospital. That way we can get things expedited for you. And once you get there and the cath lab is ready, we can get you down there and get things opened up for you, and they can start getting some stents placed. Everything moves very, very quickly. It sounds like it's a lot that we're doing. And it's kind of something that we say in the ER is if there is not a whole bunch of nurses or doctors running into your room, you're doing great. If once you see a bunch of us start running into your room, then you know that things are not quite going well and that we're going to get things moving quickly for you. Another important topic is early CPR and early defibrillation. So each year, 475,000 people die of a cardiac arrest just in the United States. Of those people, only 10% occur in the hospital. So 90% of those people are going into cardiac arrest somewhere outside the hospital, at work, at home, or in a public place. It could be at church, it could be at the shopping center, it could be at a school. High quality immediate CPR will double or triple a person's chance of survival. And like I said earlier, time is muscle. After 3 minutes, the lack of blood flow to the brain will lead to brain injury and will progressively get worse the longer time goes on. After 9 minutes, severe and permanent brain damage is likely. And after 10 minutes, the chance of survival is very, very low if CPR is not started. If you've ever taken CPR classes or seen pretty much any television show anymore, they talk about the chain of survival. And what the chain of survival is, it is talking about early activation. So this goes back to recognizing the signs of a heart attack and recognizing a cardiac arrest. And if you're someone who knows CPR, have someone else go call 911 while you start chest compressions. Let them go get help while you start taking care of the person. High quality CPR. If you've not taken CPR training in some time, the emphasis is on chest compressions, not as much on the breaths that are given. So we want to emphasize very high quality chest compressions. You got to remember to push hard and push fast. The goal of chest compressions is 100 to 120 beats per minute. So that's about 2 chest compressions every second. And defibrillation. There are many public defibrillators in the community. They're in churches, they're in high schools, airports, shopping centers. Even if you're not trained in CPR, these defibrillators will give step-by-step directions on how to run the defibrillator. Once you open it, it starts giving you instructions. Each of them looks a little bit different, but for the most part, they do the exact same thing and go on the same way. In advanced resuscitation, we need to get the EMTs and paramedics there as quickly as we possibly can to start giving medications and start giving additional treatments. Post-cardiac care, we need to figure out why did this person go into a cardiac arrest? Is it an issue with oxygen? What caused it? And we need to treat it. Once we get a pulse back and we get their heart beating again, then we start talking about recovery. person's going to go through a whole lot of tests and procedures. Even once they're discharged from the hospital, they are probably going to go through cardiac rehab. They may have needed a pacemaker implanted or a defibrillator implanted to prevent additional events from occurring after this. And another acronym, putting it all together, kind of shows how this all goes together and ACT. So ACT now.
Are you okay? Are you okay? You, call 911. You, get an AED.
This is a scene that plays out over 1,000 times every day in the United States. If you see or find an adult or teen who has collapsed, they could be in cardiac arrest, and you need to act now. Assess for any signs of movement or normal breathing. If the person has slow, deep gasps, this is not the same as breathing. Call 911 or direct someone to call. Treat. Press hard and fast on the center of the chest. Place the heel of your dominant hand directly on the center of the chest and interlock the fingers of your other hand. Keep your arms straight and lean over the victim using your body to compress the chest. Push down hard. You need to compress the chest at least 2 inches and push 2 times every second or 120 times per minute. Allow the chest to recoil completely with each compression. If the victim is on a soft surface, like a bed or a couch, move them to the ground before beginning compressions. You may have heard in the past that you must do mouth-to-mouth ventilations. Mouth-to-mouth is not needed for adults or teens and could be harmful. Perform chest compressions only. However, mouth-to-mouth is needed for young children and infants. While performing chest compressions, direct someone close by to get an AED. The AED, or automated external defibrillator, is the only thing that will shock the victim's heart back into normal function. When the AED arrives to the victim, simply turn it on and follow the voice-guided instructions.
Unit OK. Stay calm. Check responsiveness. Call for help. Attach defib pads to patient's bare chest. Don't touch patient. Analyzing. Don't touch patient. Analyzing. Shock advised. Don't touch patient. Press flashing shock button. Shock delivered. Start CPR.
The AED will only deliver a shock to someone who needs it, so do not be afraid to put it on anyone who is unconscious. Now that you know how to act, let's watch this again.
Are you okay? Are you okay? You, call 911. You, get an AED.
Keep your arms straight and lean over the victim using your body to compress the chest. Push down hard. You need to compress the chest at least 2 inches and push 2 times every second or 120 times per minute.
Unit OK. Stay calm. Check responsiveness. Call for help. Attach defib pads to patient's bare chest. Don't touch patient. Analyzing. Shock advised. Press flashing shock button. Shock delivered. Start CPR.
In many instances, an ambulance or other medical professional can be 5 to 10 minutes away or more. Continue chest compressions while rotating compressors every 2 minutes until help arrives, and continue to follow the instructions of the AED or 911 dispatcher. You be the hero. Teach your friends and family to act now.
So there are several different models of defibrillators, and I'm not endorsing any certain type of model, but like I said, they are all pretty much the same. You turn them on or you open the cover of it and it'll start giving you instructions on how to use it. American Heart Association is what most hospitals and EMS use as their training for CPR BLS. So they have a goal for cardiovascular care in the United States. And it is a pretty attainable goal. It's not something that's going to happen tomorrow, but it is stuff that we are already in the process of doing and have steps that we're moving towards this.
Let me tell you something. I want to give you something to think about. It's a number, a big number, about 475,000. 475,000 isn't just a number, it's people. People who died from cardiac arrest in 1 year in the United States. Big number, bigger opportunity, because we can get that number down to 0. We can save all those lives. We can create a world where no one dies from cardiac arrest. Am I dreaming? No, I'm not a dreamer. I'm a visionary. And I'm asking you to be too. I want you to see it first, that world, and then do your part to make it happen. I need you to believe in your heart that it is possible, and then focus all you do, help focus all we do on that goal, on saving every single one of those people. Because we can do it. It is within our reach. How do we get there? You know how we get there. We'll create systems that automatically detect cardiac arrest and activate an emergency response. We'll mobilize an army of trained and prepared responders to provide immediate CPR and defibrillation. This means pairing 911 response with bystanders through mobile technology, ensuring public access to AEDs, and more training through schools and kiosks. We'll remove barriers to getting bystanders engaged, creating tri-standers in the general public. We'll eliminate preventable cardiac arrest in hospitals using monitoring for early detection and rapid response teams that will stabilize patients immediately. We'll make sure all healthcare providers deliver high-quality CPR with innovative quality improvement tools and sessions. And finally, we'll personalize resuscitation to each patient, leveraging the latest technology to identify and treat underlying causes. To get that 475,000 down to 0. It starts with you right now. You're doing good work. We do good work that has laid the groundwork for us to be truly extraordinary. Believe in the vision. Let it drive everything you do each day. Let it rise up in you like a shout, joining the voices of your colleagues, teammates, neighbors, and family. And then look around. See that number start to decline, life by precious life, bit by bit, until that one glorious day when everyone who would have died before all this work instead wakes up groggy and thankful in a hospital to greet his or her family, and we arrive gloriously at 0. Because of you, because of our vision, a world where no one dies from cardiac arrest. Let's get started.
So like I said, it is an obtainable goal, and hospitals in the area, we're already using rapid response teams. This is something that's already in place, and the technology, and there's actually apps out there that once you're trained for CPR, we don't quite have them in Wayne County yet, but it is being talked about, that someone needs CPR in the area, it would send out a message to these apps, and any bystander that was close would know where it was. And if they were able to, they could start CPR while they're waiting for EMS to get there. This is in larger cities, and we're kind of moving our way there. And while this goal of 0 cardiac arrest deaths it's not obtainable tomorrow, but it is an obtainable goal here in the future, here in Wayne County. It's just a matter of one step at a time as we work our way through this. And we actually have a lot of very high technology in this county. Like I said, we're actually pretty blessed. I think more than what people actually know of our capabilities and our possibilities here in the county. So ways to improve outcomes and assist the first responders. In the United States, the average EMS response time is 7 minutes. That time is affected by different factors. You know, is it a full-time department? Is it a part-time department? Is it a volunteer department? What time of day is it? What are the weather conditions outside? Are there other emergencies occurring at that time? And like I said multiple times in here, we want to encourage people to call 911. Please don't try to drive yourself to the hospital. And as I've mentioned, EMS can start treatments and notify the hospital that they're coming so we can get other things ready for you. If you call 911 and you have a business that has a lot of gates or a lot of different doors, tell them what gate to go to or what door to go to. And then have somebody at that gate or at that door to meet EMS or the first responders to escort them to the location and get them as close as they possibly can. Training. Please offer first aid training and BLS training to your employees. And our goal is to train as many people as possible to be ready for an emergency. And if they never need that training, that is absolutely wonderful, because that means no one's getting sick and no one's getting injured. But the reality of it is that no matter, it's not a matter of if, it's a matter of when it occurs. It's going to happen. We just want to make sure that we are prepared for it. And specific considerations to each company. There are companies with large machinery, equipment that may cause entrapments. So if you have machinery like hoppers or presses, equipment with large moving parts, have somebody there when EMS and first responders arrive that is an expert on that machinery. Somebody either from your maintenance department, the actual machine operator themselves, or an engineer that knows what parts on that machine move, how to disconnect it from the electric, where's the emergency shutoffs, what kind of machine is it, and what does it do? What is it meant to do? What does the inside of the machine look like? So if it is a fact of somebody is trapped in the machine, is it smooth on the inside? Is it hot? Does it have jagged edges? Are there spikes or razors on the inside of it? All of that information can help determine the best way to treat the patient. So it may not always be as easy as just simply pulling the victim out of the machine, because if it is something that has spikes or jagged edges, we may actually be doing more damage by just trying to pull them out. So make sure that you're able to tell EMS exactly what kind of a machine this is and what it does. If you're not sure on different ways that you can help, ask your local fire department to come out and help analyze your business. What can they show you? Ask them to look around and help you pre-plan emergencies. Pre-planning emergencies actually can save a lot of time and anxiety when the emergency happens. So if you have a company that has 3 stories with a very narrow staircase or only ladders to get up and down, work with the fire department on plan. How are we going to get the victim out of there? How are we going to get that person from the 3rd story straight down a ladder? Like I said, planning early and practicing early saves a lot of anxiety whenever it happens. Ask them to analyze, your facility and find other hazards. Not only the fire department, but ask the police department to come out and analyze potential hazards. You know, unfortunately, in the day that we live in, we need to try to protect our employees as much as we can. So ask the police department to come out and look around. How can we help make our employees safe if something should happen here? Do you have special equipment like a full room of lithium batteries or a room of chemicals or different hazardous materials? And if you do, tell the fire department that. Make sure that they know, because that will change how they approach that area. Employee information. Most companies, whenever they hire someone, will have emergency contact for information for the employee, but how often is that actually updated? So think about your staff. How frequently is someone getting married? Is somebody getting divorced? Are they having medical condition changes? If their emergency information and contacts are not up to date, it can make it more difficult for EMS to get a hold of family members, or the ER staff to get a hold of family members. So this information needs to be updated frequently. Another question is, if there's an emergency at 3 o'clock in the morning at your facility, who has access to the emergency information? Do you have a supervisor or someone who can go get that information? It's not always that the person or the victim can tell us or answer any questions for us, or maybe they've never been to the emergency department before. Their phone's locked. We can't get in and look at their emergency contacts. So we have no way of contacting family members, and this can be a delay in treatment, a delay in notifications. And unfortunately, there have been times that we've had to have several police departments attempting to locate family or friends or somebody who can tell us anything about this patient. Because unfortunately, the employer did not have any updated information. The information that they had was 10 years old. So we had no information on this employee. So please consider, updating yearly, maybe, at least emergency contact information, and make sure they have somebody we can contact that knows something about them. And training. We are very blessed in this community, as I said, to have several specialty trained teams. And I'm not sure if you're aware that Wayne County actually has a confined space rescue team, a rope rescue team, a trench rescue team, a water rescue team, and a hazardous materials team. And that's just Wayne County. We're not talking about any of the specialty teams that come from around surrounding counties. So kind of look around your business. How would you benefit from these teams? Do you have, a large lake in the middle of your property that something may happen and you need the water rescue team? Do you have areas of confined space? Do you have, areas that maybe the rope rescue team would need to come in one day? And if you do have those type of areas, contact those teams and ask them, hey, would you come out and look with us? Would you look at how we can help? Will you please come out and pre-plan with us? Let's look at what we have and what we can do to help. And if your business, consider, would you benefit from a first aid or like a first responder team at your facility? I know there are several businesses that have a first responder team, and they can start treatment while they're waiting on EMS to get there, and start when the emergency happens, getting treatment and getting information. Our training facility actually does accept some EMT students in our courses that would be backed by an industry. So they wouldn't have to be on a fire department, but they could be on your first responder team. And at the end of the training, after successfully completing all the testing and everything, you would have a first responder team that actually is certified in the state of Ohio as an EMT and able to help in those type of situations. And finally, be a detective to help us. Now, if it's somebody who is having a stroke, has anybody talked to them today? What time did they get to work? And how did they get there? Did they drive themselves to work today and now they can't move their entire right side of their body? Because if they did, then odds are they were okay when they drove to work. So that gives us an idea of where we can start from. Have they eaten anything today? Who was the last person to talk to them? And when you talk to them, were they complaining of anything? Did they say that they didn't feel good? Kind of help the first responders by keeping bystanders and onlookers back. If you have a company that has a lot of tow motors or trucks driving back and forth, stop that traffic during the emergency. Let the EMS and firefighters get in there and do what they need to do, and then you can return to normal practice after that. So just a couple last stories here, and then if you have any questions, I'm more than happy to answer them or explain anything else further to you.
An Avon man says he is thankful for his life after the quick thinking and skill of a fellow co-worker and friend who saved him.
Tonight, our Emily Longnecker tells us how one man didn't hesitate to help a friend who happened to be in his greatest hour of need.
Thank you for saving my grandpa.
Well, you're very welcome. I'm glad I could. Give me a hug.
If time is precious, then Richie Riddy Meraldo just gave 9-year-old Eileen and 5-year-old Lila the most precious gift of all. More time with their grandpa Brian.
When I seen him laying there, I thought he just knocked himself out. That wasn't the case.
58-year-old Brian was having a heart attack Monday morning right outside Parabellum Indoor Range, where both men work.
We were doing a little power washing that day in the driveway, and all of a sudden, within a split second, I got lightheaded and blurry-eyed, and that's all I remember.
So I turned around, and he's laying down, and I thought, well, he just tripped. So I was just trying to get him awake, and he was snoring. So I thought, well, I'm not getting nowhere. So I called 911. The dispatcher said, is he conscious? And I said, no. She said, is he breathing? I said, well, he's snoring. And that's when she said, you need to start CPR now.
So that's what Riddy, who used to be a volunteer firefighter and knew CPR, did.
No, all I know is I was doing the compressions, and he was turning blue. Oh, I was scared to death.
Within minutes, paramedics got there and took over.
Well, 25 minutes of CPR and 3 shocks.
Shocked him 3 times.
It's a Band-Aid.
Had Riddy not been here, we would have lost Brian. Just plain and simple, and the fire department told us that.
Most people might have panicked. They just froze that 3 or 4 or 5 minutes where it really needed the help.
Don't call Riddy a hero, though.
No.
He don't, but he is.
No.
Yeah.
No, anybody else would have done it. So, or tried to do it or whatever.
Yeah.
I mean, you just don't let somebody lay there and die.
3 days later, Brian McDonald is just thankful to be standing here, talking to the man who's the reason why.
I gave him a big hug. I said, don't squeeze too hard because my chest still hurts. So I knew I broke a couple tears and gave him a hug and said, you're my hero, buddy. So.
And thanks to this hero,
I can't bend that far.
These 2 little girls have one of their heroes to still grow up with.
5. 5.
He's calling it a Christmas miracle. A man who a hospital representative said was without a pulse for 5 minutes, up and talking.
The heart attack victim says it is all thanks to the quick-thinking workers at a car dealership who started CPR after he fell out. The whole thing caught on camera. The Night Team's Devin Clark with the emotional story of the gift that keeps on giving.
He called me and told me, he said, I got a car for you. Come and get it before we sell it.
When 61-year-old Robert Mauricio walked into 57 Auto Sales on Fredericksburg Monday, he planned on leaving in a new car. But instead, he left on a stretcher and an ambulance.
I told him, I says, I don't know if I'm having a seizure or something because I don't feel good. He says, all of a sudden you dropped, that was it.
And the next time you woke up?
I think I was here.
Mauricio later learned that as he was about to complete the deal, he suffered a heart attack.
He was sitting right there, and he leaned back, his head hit the wall.
The life-threatening episode caught on camera.
Convulsing. I didn't expect it to be real. I went, really? Because he had just told, who's going to tell you something's about to happen when it happens?
Even though Mauricio says he never had heart problems, it was real. In this video, you can see that moments after finance manager Bernie Lopez runs out of the room for help, workers at the dealership return and administer CPR.
It's like you could never give enough thanks or pay enough thanks for what they've done for me.
Minutes later, EMS workers arrived and took over from there. A hospital representative says Mauricio was without a pulse for about 5 minutes. He calls what he went through a Christmas miracle.
It's incredible how they reacted.
As for that car he wanted
me to go sign him up at the hospital. We just put it on hold. I told him it'll be on hold. But yeah, he's going to get the car.
Brian now has a pacemaker and defibrillator.
And of course, Mauricio.
Okay. And then one final local story to share with you. And you may have heard this story before, may not have, I'm not sure, but so, and I have permission from this young man's family to share this story. This is, these are the Rutherfords. So mom is Erin, dad is Mark, and then Ethan is the young man that's there in the picture. Just about 3 years ago, so on January 20th, 2018, Wooster was hit with a very large snowstorm. We got 12 inches of snow that day. And 14-year-old then, Ethan, was at home helping his dad repair the snowblower. And while they were doing this, before they got to take it outside and try it, Ethan suddenly collapsed. He still had his snow coat on, and his mom, Erin, checked to see if Ethan had a pulse, and he did not. So she called her husband to start chest compressions, start CPR, while she called 911. Paramedics were able to be there within 4 minutes, and they took over chest compressions, and they shocked Ethan multiple times with a defibrillator. Ethan was taken to Wooster Community Hospital, where he was stabilized and then transferred to Akron Children's. EMS had to be escorted by snowplows from the residence to Wooster Community Hospital and then on to Akron Children's Hospital. The roads were only plowed wide enough for the ambulance to get through. And the roads were getting bad so fast that Ethan's grandparents, who were only about 15 minutes behind, were not able to make that drive to Akron because things were deteriorating so quickly. Ethan spent 17 days in the hospital. He made a full recovery and went home with an implanted defibrillator. Later, Ethan and his parents and everybody who made this happen and saved Ethan's life that day got to meet and got to hear the entire story for the first time. Like, every bit of it, knew a little bit of the story, but never got to hear the true miracle of events that occurred and how everybody was in the right place. You see, 6 months before that, Ethan's dad, Mark, had learned to do CPR because they were going to go on a Boy Scout trip. That morning, Ethan and his parents were supposed to go to church, but services were canceled because of the snow. The battalion captain actually happened to be out in the area when they called 911, and he was able to get to the house quickly to help the EMS crew get Ethan out of the house. Because of the snowstorm, some of the ER staff was actually snowed in at this hospital and had to stay the night there. Knowing that it would be difficult to get anybody critical out, the ER staff already had come up with a plan of who was going to take a transport if it was needed. And luckily, all these plans were put into place. The quick thinking 911 dispatchers started arranging snowplows to get this ambulance from Wooster to Akron Children's and to get Ethan where he needed to be. If I've not given you any other reasons to consider training your staff in recognizing stroke and first aid and early chest pain and cardiac arrest and CPR recognition, please let this be a key story. This is a very true story of miraculous events that helped this young man, who's now 17 years old. And so if you remember me telling you that average EMS response time, depending on certain conditions, is 7 minutes. EMS was there in 4 minutes. No, in 3 minutes, there starts to be brain damage, and dad started CPR on Ethan immediately. So all of these events work together to miraculously save this young man's life and make sure that he is okay. And I tell you this story because there are several staff members here at the training facility that were part of this event. And let me tell you that they will tell you there was no greater feeling than when everybody got to see each other, and Erin, mom, just hugged everybody and thanked them for all the wonderful things that they did. So it was very touching just to meet them and put all of this story together and hear how blessed all those events went together. A terrible snowstorm that everybody else wondered, why is a snowstorm happening, probably saved this young man's life. Because if they would have been at church, he would have been a lot further from EMS than what he was. So a turn of events actually saved this young man. So that being said, let me switch back here. That is all that I have. I don't know if you have any questions about what we do out here, any questions that I have, anything else that I can answer for anyone.
We have a couple comments here I'll read for you. Rich had said that all of this makes me wonder, when was the last time anyone planned first aid training for their first responders? And then I'll just share Barbara's comment. She just said, Erica, thank you so much for such an informative presentation. It's nice to learn we have so much knowledge and support here in our neighborhood. A big thank you to our first responders. And Barb Knappik says, excellent presentation. Thank you.
Thank you.
Yeah. Amy just left a comment. Great information. Thank you. I'm going to be chatting with our management about getting some training. That's awesome. And yeah, if nobody else has any other comments or questions, I think we can wrap it up today. Thank you so much, Erica. This was really informative, and I hope that everybody got a lot of safety updates here that they can implement in their businesses. So thank you so much.
Thank you.
Remind everybody also that our next meeting is February 23rd, and Nicole Smith with the Ohio Department of Health will be with us to discuss the impact of prediabetes on the workforce. So thank everybody for being here today with us, and we'll see you all again in February.